Hi everyone. So today our group will be presenting on the topic of how prisons have become the latest mental health crisis. The agenda for our discussion today will include incarcerated persons, which will discuss the correlation between mental health illness and the incarceration rate as well as its impact. Then we will discuss Rutgers resources that are available to help combat mental illness. Then we will also cover the health promotion needs, specifically the importance of timely medications and therapy, as well as the health disparities that exist and the preventable issues that must be addressed and resolved. As an example, we will discuss the tragic case of J. Michael Mitchell and what happened to him during his own incarceration. We will then focus on the mental illness rate and the healthcare approach of our own state's New Jersey prison system, specifically the prison systems in certain counties, such as Cumberland County, Morris County, and Bergen County. We will also discuss the upstream effects of the policies and protocols that are or should be implemented to resolve the issue, as well as the midstream effects of how the local communities are working together in an effort to resolve this issue. Mental health illness has become so prevalent in inmates in recent years that prisons are now being called the new asylums, due to the high concentration of individuals with mental disorders, with about 45% of the jail population reporting a history of psychological issues, and nearly half of those reported having serious psychological distress within the past 30 days. The percentage of individuals, which is about 26% in jails, who meet the threshold criteria for serious psychological distress is more than 5 times greater than the general population, which is only about 5%. The lack of health care for the mentally ill leads to an overwhelming number of these individuals being incarcerated because it is much cheaper to simply imprison them than to develop effective mental health care facilities. Statistics from the National Alliance on Mental Illness shows that 63% of incarcerated people do not receive proper care while suffering from mental health conditions. The financial influences are evident, since data also shows that impoverished communities have less access to mental health care. It's estimated that less than 15% of impoverished individuals with mental health disorders actually receive the services they need, and even fewer numbers actually complete their treatments, which can lead to a huge health disparity. Research examining the demographics of the inmate population shows that in addition to being impoverished, which already disposes the individual to developing mental health issues, these same individuals also have addiction problems of either drugs, alcohol, or both. Statistics show that approximately 8.9 million Americans have both mental health problems and addiction issues. There's also data showing that exposure to stress and life experiences can contribute to the development of mental illness and addiction, since stress impacts the body's dopamine levels, which predisposes the individual to developing mental disorders and the inclination to use drugs and/or alcohol. For instance, 85% of the prison population has an active substance use disorder or were incarcerated for a crime involving drug abuse. While research can adequately explain the factors that lead to mental illness, it is a much more complicated issue to address when it comes to the criminalization of the mentally ill. There has been a popular theory linking the closing of state psychiatric hospitals in the 1950s to the current state of the prison systems becoming the new asylum for the mentally ill, since the mentally ill rates found in inmates are about 4 to 7 times more common than what is found in the general population. The reasons for this are complex, since there are multiple correlations of mental illness leading to incarceration. For example, people with mental illness tend to already have problems coping with their daily lives and often have disruptive behavioral problems. These problems can contribute to conflicts with the law, as poverty may lead to robbery, or addiction may lead to crimes relating to drug and/or alcohol abuse. And oftentimes, the symptoms of the mental illness itself will cause the criminal offense, since the paranoid delusions or manic episodes are mental states that may motivate aggressive behavior leading to criminal activity. An enhanced understanding of how mentally ill individuals become incarcerated will help us better understand how the prison systems can better support them.
The fight against the latest mental health crisis can be specifically looked into by examining the specific efforts made by Rutgers University. The approaches taken by Rutgers in tackling the mental health crisis for Rutgers students as well as the community can be delineated by the programs CAPS and UCHC. CAPS stands for Counseling, Alcohol, and Other Drug Assistance Program and Psychiatric Services. It serves as a mental health support service offered by the school, prioritizing individual care, accessibility, and inclusivity. The program includes crisis intervention, individual therapy, group therapy, workshops, alcohol and other drug-assisted programs, psychiatric care, and community referrals. The organization UCHC, or the University Correctional Care, offers medical, mental health, dental, and sex offender treatments for the inmates, residents, and parolees of the New Jersey Department of Corrections, or NJDOC, the Juvenile Justice Commission, or JJC, and the New Jersey State Parole Board, or SPB. The program seeks to promote accessible, evidence-based, safe, and clinical treatment options, and some examples of the provided treatments include COVID testing, primary care, urgent care, and physical therapy. By combining the student body with the community through the program UCHC, Rutgers students are able to engage with the criminal justice system, leaving a positive impact. The health promotion needs of incarcerated individuals can be described by the shown statistics provided by the Prison Policy Initiative. According to such statistics, 43% of inmates in state prisons have a mental disorder. 74% of inmates in state prisons and 66% of inmates in federal prisons reported they did not receive any mental health treatment while in prison. Based on these findings, it can be concluded that the health promotion needs of incarcerated individuals are not met. In accordance with this, it has been found that incarceration can lead to family disconnection, loss of independence and purpose, increase in anxiety due to unpredictability of prison life, and trauma due to overcrowding, violence, lack of privacy, lack of purpose, isolation, insecurity, and lack of health services. Health disparities can be both the cause and result of incarceration. Factors such as inadequate education and racially stemmed disadvantages can be linked to incarceration. For example, the rate of incarceration for white men of the ages 20 to 34 years old with a high school diploma is 1 in 57. Conversely, the rate for the same demographic but without a high school diploma is 1 in 8. In addition, instances faced by disadvantaged racial minorities in relation to incarceration include the following statistic. The incarceration for Black adults is 6 times the imprisonment rate for white adults. Also, the likelihood of being expelled or suspended from school for Black students is 3 to 4 times the likelihood for white students. On the other hand, incarceration can lead to health disparities such as medical issues and disadvantaged children. In terms of medical effects of incarceration, imprisoned individuals are more likely to suffer from high blood pressure, asthma, cancer, arthritis, and infectious diseases. Because of the influence of incarceration, its lasting effects on imprisoned individuals manifest into physical illness. Additionally, children of incarcerated guardians or parents are more likely to face poverty, homelessness, physical or substance abuse, and suicidal thoughts. These children are at a higher risk of having learning disabilities, developmental delays, attention disorders, and aggressive personalities. On top of this, they are 5 times more likely to enter the criminal justice system than children of non-incarcerated parents. This correlation between the education and justice systems can be described as the school-to-prison pipeline, as the tendency of American students from low-income and underperforming schools being placed into the criminal justice system grows.
Virginia resident J. Michael Mitchell was just 24 years old when he was arrested for stealing about $5 worth of items from his local 7-Eleven. He suffered from both bipolar disorder and schizophrenia, and had been off of his medication prior to committing this crime. Due to his condition, he was ruled unfit to stand a trial and was ordered to be treated at a psychiatric facility. Unfortunately, there were not enough beds to allow for J. Michael to reside there, so he was sent to a jail to wait for an opening. While in jail, he was horrifically neglected. It was said by fellow inmates that he could be found pacing back and forth in his cell completely naked and covered in his own urine and feces. He was refusing to eat and to take his medication.
yet nothing was done to combat these issues. Eventually, because of the conditions he was subjected to, Mitchell died of cardiac arrhythmia, a heart condition caused by massive weight loss, most likely due to his lack of consumption. This was only 4 months after imprisonment. Not only his family, but many people were enraged by this case and the horrific conditions this clearly mentally ill person was subjected to. The jail claimed that Mitchell's death was not their responsibility and that the blame should not be placed upon them. As Mitchell's family and the judicial system began getting involved, it was revealed that the hospital administration coordinator, Gail Hart, didn't act on the judge's initial order for Mitchell to be transferred to Eastern State Hospital in Williamsburg for treatment. Thus, not only was she a part of the problem, but so was the jail, as it was their responsibility to care for this patient. But the lack of care and concern for this individual is what led to his tragic death. In 2017, U.S. District Judge Rebecca Beach Smith noted the passage of the J. Michael Mitchell Law, designed to establish a procedure to investigate correctional systems that are violating the basic needs of mentally ill patients to prevent this case from repeating itself. Overall, the state of New Jersey prison systems is relatively decent, as only 20% of New Jersey prisoners are mentally ill. And although this statistic may not sound very promising, it is a lot lower than other states. However, basic needs continue to not be met. Inmates have reported that their medication was not ordered on time, and that staff had a delayed response to ill, suffering patients that needed care. The main reason why this issue was so adamant is mostly because of the lack of space in hospitals and clinics, and additionally, the lack of resources for the mentally ill in these prisons and jails. Those who commit crimes are forced to wait for an opening in jails and prisons, similar to what Mitchell had to face. This leads to more mentally ill people being incarcerated than being treated in the psychiatric clinics or hospitals that are designed to help them reintegrate back into society. The result of this can be tragic, similar to what we saw in the case study prior to this. Incarcerated or not, these people deserve the treatment they require to survive. Mental health and access to mental health resources is the third highest request in New Jersey prisons, and clearly this is still an issue that we need to work through. Ultimately, complaints by both inmates and loved ones indicates that New Jersey prison systems have a long way to go.
The quality of health and mental health in Cumberland County is very alarming, with about 50% of people finding that their mental state and health issues are their primary concern. In addition to this, there's been a 26% increase of children aged 6 to 12 seeking out emergency department services for mental health in 2022. Truancy rates have also quadrupled. The quality of life is so poor in Cumberland County that it has been ranked the unhealthiest county in New Jersey. According to this chart from Vera, which uses researchers, professional organizers, and government officials to compile evidence-based charts, Cumberland County has generally more people incarcerated than the national average. The number of people per 100,000 residents incarcerated in Cumberland is higher than both the New Jersey total number and the U.S. total number. There is no doubt that poor mental health is linked to incarceration. In fact, people that suffer from mental illness are more likely to be arrested, charged, and jailed for a crime. They also generally serve more time in comparison to the general population. People who suffer from untreated psychiatric diseases and mental health illnesses have an increased risk of committing a crime. This chart, which is given by mycentraljersey.com, shows that out of all counties, Cumberland has the highest incarceration rate of all New Jersey counties, with 444 residents incarcerated per 100,000. While residents are incarcerated, there have been allegations of neglect and abuse in Southwood State Prison located in Cumberland County. This is including a prison-wide water outage, leaving prisoners without water for an entire day, and poor health and mental services provided for the prisoners, who find it extremely difficult to lead a successful life after their release. Unsolved issues with mental health is also a contributing factor to prisoners becoming reincarcerated after their release from prison. Morris County was rated the healthiest county in New Jersey and has a multitude of programs for their inmates being held at their correctional facilities. They offer mental, dental, and medical health services, such as anger management counseling, substance abuse counseling, addiction counseling, vocational counseling, and release counseling.
They provide education such as GED classes and pre-GED classes. Bergen County is also one of the healthiest counties in New Jersey, and they provide mental health units, medical units, a 3-level triage system to accurately diagnose inmates suffering from mental illness, and hospital-based services for those who are seriously ill or chronically suffering from mental illness. Comparing both of these counties to Cumberland, they both have significantly decreased incarceration rates and better quality of life, showing that mental health services are vital when focusing on the well-being of citizens and in decreasing the incarceration rate within the population.
Upstream solutions. For upstream solutions, the root cause of poor mental health in prisons needs to be addressed. A primary barrier to gaining mental health care resources in prisons is the lack of state funding. This leads to an absence of proper resources and qualified physicians, which prevents prisoners from gaining medication and therapy. Ultimately, mandated mental health care for all prisoners needs to be passed. This should include all prisoners being assessed by a mental health care professional upon entering prison to prevent diagnoses from going unrecognized. This can reduce the number of people in solitary confinement since there is a large association of people with pre-existing mental health care conditions ending up in confinement, and this can prevent the number of incarcerations and also reduce the number of people experiencing new mental health disorders in prison. And ultimately, we need to ensure continuity of care after release to prevent reincarceration. Some pre-existing upstream solutions. One example is that in 2015, the U.S. Senate passed the Comprehensive Justice and Mental Health Care Act, and this promised to increase support for veterans treatment courts, and it also reauthorized the use of mental health courts, and it provided more mental health resources in jails and prisons, and it provided innovative training for law enforcement. Another example is drug courts, which are behavioral health centers. These provide rehabilitation to nonviolent offenders through treatment of drug abuse and monitoring. The court team works together to create a recovery plan for the victim. The first drug court was established in 1989, and they have since been proven to be successful and are still used today. Some midstream solutions. Schools have started providing mental health services at early ages, and this specifically targets children living in abusive homes and underdeveloped communities. And the importance of these services can be summed up in this Robert Wood Johnson Foundation quote: "Counties with smaller populations, larger percentages of individuals that did not graduate high school, that have more health-related issues and provide fewer community treatment services are more likely to have higher jail population per capita." This shows that by starting mental health resources at early ages in schools, we can reduce the amount of children ending up in jail as adults because of the inequalities that exist in the current system. And another example of a midstream solution is concerned family members and prison staff putting in requests for more mental health care resources. And this depicts how communities are fighting for better treatment in prisons. In conclusion, incarceration is not a solution to mental illness. Mental illness is a huge problem among prisoners, and prisons have even become called new asylums. And this overwhelming majority of prisons not offering mental health care resources is very damaging. And this lack of health care leads to prisoners' pre-existing mental health care conditions worsening and prisoners developing new mental health illnesses because of prison's treatment. And these struggles lengthen people's sentences, lead to solitary confinement and reincarceration, and ultimately, the midstream and upstream solutions mentioned before need to occur to end this problem, such as mandated mental health care in all prisons, which includes screening everyone, providing therapy and medication, starting school programs to prevent incarceration at a young age by providing mental health care resources, increasing state funding, and utilizing drug courts. And then here are our references.